if you want good leads, these are what your leads are looking for. What somebody experiences month 1, month 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. What the patient experiences and the checkpoints that are in place along the way when presented to the patient, what their plan and program looks like for the first year and how you're going to take them from sad patient to happy patient. The line in here is the journey. That's the patient journey. And they want to be able to clearly see step by step how enrolling in your program, membership, subscription, how somebody is going to get from where they're at to where they want to be, and the checkpoints along the way that are going to create accountability for them. You have a pretty good likelihood of enrolling somebody in your program. All these longevity clinics are popping up that have hyperbarics, they have cold plunges, they have red light saunas, they have all these things that people can go and use. That is a membership. That is not what we are creating in these wellness clinics. If I wanted to sign up for something like that, like I live in South Florida, I'm just going to go for a run and jump in the ocean. Like I don't need to pay somebody $250 a month. I don't need to do that. That is a subscription. That is a membership. That is not what we create in these wellness clinics. Your leads are bottom of funnel, meaning they are close to ready to buy. Somebody who's top of funnel in the wellness space is looking for, I'd feel tired. I'm 32, 3 years old and I don't have the energy I had before. That's top of funnel. They are problem aware. They're not yet solution aware. There's different levels of market awareness where your leads are at in the funnel. Top of funnel means they're just starting to look for a solution. Bottom of funnel means they're ready to buy. So when we do SEO, we focus on bottom of funnel search terms. Hormone replacement therapy for men, ipamorelin, sermorelin, people searching, and clomiphene, people searching for things by name, which means their readiness to buy is much higher. When you're building these programs, these memberships, you want to include the things that people are looking for. Include the meds. That's what the patients want. The patients want to have an increased perceived likelihood that they are going to get the result that they are looking for. That's why these TRT memberships work so well. That's why these low ticket $199 a month, $299 a month TRT memberships work so well. Guys just want their meds and they want somebody that they can call when they run out. Now you can add in more value and you can create this concierge level experience and give discounts on peptides and increase the price, include these follow-up consults, have more credentials, be a more experienced doctor. That allows you to charge more for your services. But ultimately, what we're seeing right now is an increase in solution awareness. People are looking for tirzepatide by name, semaglutide by name, retatrutide by name, which is crazy because like years ago, people had no idea that peptides even existed. Now you can buy them straight from websites online. But like there's more and more market awareness and solution awareness developing around longevity medicine, anti-aging, peptides, hormones, etc., especially in the women's health area. So if you are building your programs, you want to make sure that the meds are included. You're not building a subscription. Like I was working with a clinic in Sarasota the other day. They were like, nobody's enrolling in our programs. I'm like, yeah, because you're not giving them what they want. Like they don't want to pay $700 a month to talk to a doctor. The doctor's going to tell them the same thing that the doctor's been telling them for years. They want to have an increased perceived likelihood that they're going to get the result that they're looking for. And there's a couple different approaches that I'd like to present at the end of a consultation. A natural approach, a synthetic approach, and a combination of both. Pricing is in alignment with the different approaches. So the natural approach is more supplement related. Synthetic approach, you may have meds involved. And then the third approach is a combination of both. And you can present your pricing to them in alignment with the different levels of investment. So obviously natural being the least investment and a combination of both being the most. And then you can litter in your consultations and your checkpoints along the way. I like to do consults month 1, month 2, month 3, month 6, month 12, with intake forms being filled out at every step of the way and labs as often as the patient will allow you to do them. The more intake forms and feedback you can get from the patient, you can sell them or get them to sell themselves and why they want to continue being a patient. And then the diagnostic testing allows you to show the patient measurable results in each of these different areas. So make sure that you're doing both and then include the stuff that the patient really wants in the program.